My name is Payam Barnaghi. I'm Professor of Machine Intelligence at the University of Surrey. My work focuses on using AI and machine learning technologies and sensory data to help and support people living with dementia and their families. Most of my work involves in using sensory data coming from home devices, connected devices deployed in the home, and developing adaptive algorithms and machine learning algorithms to identify different patterns, changes from that data, and to notify clinicians when there are health-related changes in the data, and allow early interventions to help and support people with dementia. Currently we have something around over 150,000 people, close to 900,000 people living with dementia in the UK. By 2020 we will have something over 1 million people with dementia. At any given time, 1 in 4 hospital beds in the country are occupied by someone with dementia. And there are some studies have shown, Alzheimer's Society did a study recently, and they concluded around 22% of these hospital admissions are due to preventable causes. Most of our work focuses on using data collected by different sensory devices we deploy in people's home, monitoring people's day-to-day activities, physiological data in a secure and privacy-aware way. At the same time, designing machine learning algorithms can identify patterns in changes and identify conditions related to their health and well-being, and allow clinicians to do early interventions. If we can intervene early in some of these cases, we can obviously improve people's quality of life, we can improve the quality of care they get, but at the same time we can reduce preventable hospital admissions and improve the care and support people they get. Some of the work we have done, for example, we have working with clinicians with my colleagues in Surrey and Borders NHS Trust, we have developed an algorithm looks at sensory data coming from the home and trying to do risk analysis for urinary tract infections. Urinary tract infections are one of the top 5 reasons people with dementia are being admitted to hospital. If we can detect the risk of someone having UTI, we can ask them to go and see their GP, they can do some tests and identify and verify the condition, and with an early intervention people can they can improve. But if that condition remains undiagnosed, undetected, the infection can spread around the body, can result in people being admitted to hospital. That obviously adds the pressure on the hospital services. Also, it's a very difficult experiences for people living with dementia and their families and their carers. The most of our work focuses on can we use data and machine learning in a safe, reliable and a secure way, and work with clinicians, with user groups to develop solutions can help clinicians to do early interventions, and also to enable clinicians, carers and patients to be able to have access to more effective data to make more informed decisions.